Everyone, welcome to Medical Tutor. My name is Bode, and today I'm going to be talking about some coronavirus preventions which is necessary for you and your family. Of course, I don't have to go through some introductory messages on what coronavirus is. It's a very ravaging virus that has shut down a lot of gatherings, including churches, workplaces, and offices. So, all right, before we go into what we have today, I want you to please click the subscribe button for more videos on this in the future and put on the notification bell. And yes, thanks for your support. Alright, then I want you to pay very full attention to this. This is a life-saving method, and I want you to share this video after you watch it. Don't be selfish. Let's move on to what we have for today. Introduction. What is coronavirus? Coronavirus are a set of common viruses that affect the respiratory system. So you see, these viruses don't affect any other part of the system except the respiratory system, the upper tract, the bronchi, etc. They affect them. And we have two types. That is the novel and non-novel coronaviruses. Okay. Now, under the non-novel coronaviruses, we have a lot of them. Those are the ones that cause little threat to the body. You might have flu symptoms, wake up and sleep, and you're all well. But the novel types are the major ones we are dealing with in the world currently. And these novel ones, they come with a very serious health problem. Okay? Number one of it is the SARS. That's the severe acute respiratory syndrome. It appeared about almost 12 or 15 years ago, and it has yet to surface again. But currently, the one we are dealing with in the whole world is MERS. That's the Middle East Respiratory System. The Middle East suggests the name of where it was first tested positive. So then, let's talk about the symptoms of these viruses. Number one most important symptom is fever. Yes, fever. And that's why you see when you want to carry out an antigen test or anything, the first thing they check for is fever. So the second one is dry cough, where I told you the other time that it affects the respiratory tract, right? Obviously, there's going to be something like a cough. We have sneezing as well. Then we have chills. We have difficulty breathing. Anything that affects the respiratory tract will also affect respiration on its own. We have severe cases leading to pneumonia, although not in all cases, depending on how urgent or how fast the medical care gets to the person, the patient in particular. So if it is not treated quickly, it can lead to pneumonia, and in extreme situations, death. I'm very sure you've heard about the death ratio of what coronavirus can do. You've heard of the number of people that have died, and you've heard of the number of people that have been treated, obviously. So then let's talk about the mode of transmission, which is even more important, coughing. All right, this virus can be transmitted through coughing. How can it be transmitted? When someone coughs, there's going to be at least an outlet of some drops of moisture from that person, from the respiratory tract of that person. Now, if these droplets are inhaled by another person who is normal, they're going to get infected as well. Do you understand? So coughing can cause the transmission of this virus through moisture. And also sneezing. Sneezing and coughing are very similar to each other. However, sneezing is even more effective as a mode of transmission. So when you see someone sneezing beside you, you know what to do. All right then. Next one is having a contact with objects hosting the virus. As of now, a new research has shown that another type of coronavirus is out now that can last even for long on surfaces of any object in your house, which means the virus can stay for hours on your table, on your chair, or anything. All right, we're going to talk about the methods we can use to prevent contracting such viruses. The next one is careless caressing of the body openings. Talking about the body openings, I'm talking about the mouth, your eyes, your ears, your reproductive openings. Now, people carelessly touch every part of their body, especially the mouth. Sometimes you'll be doing something and you just put your fingers in your mouth, on your lips, this and this. You don't know if you have made any contact with these viruses on the objects you're holding. So it's very important for you to stop carelessly caressing the body openings. And if you want to do that, you need to wash your hand and make sure you're clean, sanitized. All right. The preventive modes. Okay, this is what we're looking for. Avoid direct contact with people. So you can see this is very difficult to do. However, for now, you need to avoid direct contact with people. Anyone per se. Ensure you isolate your family from the outside world. Anybody could have been in contact. Now, you see, it's not necessary for everybody to have been infected. But there are some people that might have made a contact with the virus before. So when you make a contact with them too, you are going to have the virus on you. Now, these people that have made contact with them, they might get home and wash their hands. But who you just made contact with them, you might not be aware of it. And because of careless caressing of the body openings, you might mistakenly put your hand in your mouth or do something that will make the virus to enter your body. Do you understand? So you have to avoid direct contact with people, not because they're infected, but there's a likely possibility you can contract it from their own surface too. All right then. Using of nose masks. You can see everyone is trying to get a nose mask since it's a respiratory syndrome. Obviously, it can be transmitted through the air. It can last in the air for hours too. So you have to use nose masks. Although not totally effective, but at least it can still curb it to at most 70 to 80%. So make sure you get a nose mask for you and your family. Then don't stay in crowded areas. Like we said in the beginning, this virus has caused the shutdown of several large gatherings, churches, etc. So which means church gatherings, offices, football places has been all shut down. And the reason why all these places were shut down is because in crowded areas there is more possibility of people coughing, sneezing, making body contact, and this can increase the spread of the virus. So don't stay in crowded areas. And to avoid public gatherings, like I've said before, it can increase the mode of transmission. Get a personal hand sanitizer in your bag. Everyone can, I think almost all ladies nowadays get all this pepper spray right now. So the same thing, you can also get a personal hand sanitizer. The same way you are getting your pepper spray. So always make sure that whenever you touch something, sanitize your hand. After touching something, or maybe before touching something, always sanitize your hand in order to clean off the virus from your hand in case there is. And 2, wash your hands before eating. This is very, very important. Remember, when you are eating, there's a likely possibility you are going to make a contact with the mouth. Obviously, you need to wash your hand before eating. And another one that we have here is disinfect every surfaces in your house constantly. I told you that these viruses can live on surfaces, right? So make sure you disinfect the surfaces on the objects inside your house. This might not necessarily be helpful to you, but at least it will be helpful to remaining kids if you have kids in your house. They are very careless. They might do a lot of things. They might touch surfaces and still put it in their mouth or other body openings, such as rubbing their eyes. And though you might be able to tell them all these preventive measures, but there's no guarantee that they will be able to follow it every time. So make sure you disinfect every surfaces in your house constantly. And I think this is the last one. Excuse the area of a sneezing or coughing individual. Excuse the area of a sneezing or coughing individual. When you notice anyone coughing or sneezing around you, make sure you walk out of their area. Don't get yourself infected, at least for the sake of your family. Okay, make sure you are safe. That is the first most important thing. Okay, let's talk about in emergency cases. In a situation where you observe any of the aforementioned symptoms, like fever, chills, breathing difficulty, it is make sure you visit the nearest clinic. You see, you have to help the society by getting yourself treated. Don't stay in isolation when you notice all these symptoms. Get to the nearest clinic quickly and get yourself tested. If it is there, then don't be afraid of anything. About half of people who have been isolated recently, they've also been released. They've been treated and they've been confirmed negative. So because you are confirmed positive today does not mean you can't be treated. The earlier you report yourself to the clinic, the earlier you can get yourself treated and be confirmed negative again. Do you understand? So that's all about the topic for today. We've already passed the milestone for 1,000 subscribers, but I want you all, if you know you've gained from today's video, please like the video, subscribe and share. We need more of this. We want the video all over the world, and I believe you can be an help to us in doing that. All right, thanks for doing that. I really appreciate it. God bless you.